Hi, today I am going to be performing a pulmonary assessment, taking a close look at the lungs. To do this, I'm going to use inspection, palpation, percussion, and auscultation techniques. I'll be doing all four of those on the anterior and posterior side of the patient. For this video, I'm going to do inspection on the anterior and posterior side and then move on. In clinical practice, if you want to do all four of them on the anterior and then move to the posterior, that's fine too. But let's get started. Hi, my name is Elizabeth and I'll be your nurse today. I'm going to be performing a pulmonary assessment on you. Is that okay?
Yes.
All right, let's get started. So the first thing I'm going to be doing is inspection, and I'm going to just note the patient's position that he's sitting in, just in a comfortable position. He is upright, not leaning over, not hunched over. In someone with COPD, they might have to lean forward and kind of prop themselves up in order to get air in their lungs. So just noting the position that the patient originally is in is kind of the first step. The next thing I'm going to do is just examine the quality and pattern of his respirations. The chest inspection allows you to see any visible signs of any respiratory distress that the patient might be in. I'm just looking for symmetrical chest movement, so both of his sides as he's inhaling and exhaling are moving bilaterally together. I'm also observing the duration of his inspiratory and expiratory pattern. Is one shorter than the other? Are they equal? And then I'm also just looking at the rhythm and the rate. So in a healthy adult, there should be inaudible respirations, usually about between 12 and 20 per minute. So his inspiratory and expiratory rate is about the same on each. Someone who has a prolonged expiratory could show signs of difficulty of expelling air. So someone with emphysema or something like that. So kind of taking note on the balance there. And then the next thing I'm going to look for on the inspection is just his effort and work of breathing. So is it shallow? Is it rapid? Is he kind of taking really short, fast breaths, or is he having to take super deep breaths to kind of get the oxygen that he's needing? And then I'm looking to see if he's using any accessory muscles while he's breathing. So is his nostrils flaring, showing that he's having difficulty getting lungs? Is he using any of his intercostal muscles and kind of seeing his ribs move up and down when he's breathing? It could be a sign of respiratory distress, or any pursed lip breathing where his lips are doing this to kind of get the air in. The next thing I'm looking at with my inspection for the assessment is the anterior posterior diameter in comparison to the transverse diameter. So what I'm going to do for that is kind of picture his chest is being cut, sliced down, and then we're looking at the top of it. And what we want here, lean forward a little bit, is the diameter from transverse, this way, versus the diameter anterior to posterior this way of his chest. And it should be in a 2-to-1 ratio. So we want this to be about twice as long as this. And someone who has a 1-to-1 ratio, where it's as wide as it is long, would be someone with a barrel chest. And then for the next part, I'm going to have you turn around. And then I'm doing all those kind of same inspections on the posterior side that I did on the anterior side, making sure symmetrical, we're not seeing any excess muscles being used, all those things we talked about. And then one other thing we will note specifically on the posterior side is the shape and position of the two scapular muscles. So are those even? Is one higher than the other? Are they protruding? His are nice and symmetrical. They seem to be moving equally when he breathes. Okay, and now that we have inspected the anterior and posterior side of the chest, we will move on to palpation. So you can go ahead and turn back around. I'll start on the front side. So with palpation, I'm just going to kind of palpate around the chest to begin, and I'm looking for any tenderness or pain with that, any like lumps or lesions that I see, any mass. And I'm just going to kind of just use a couple fingers and just kind of start up top and just kind of feel around, and let me know if you have any pain or tenderness with any of this. Okay, just moving down, kind of going side to side and then down. Okay. And then we're going to move on to the next part, which is the fermentitis test, or the 99. And so what I'm going to do is use the palmar part of my palmar aspect part of my hand, and place it on the intercostal muscles between the ribs. I don't want to go over the scapula because I won't be able to feel anything there, or you can to compare if you want. What I'm going to have the patient do is repeat the phrase 99, and I'm going to feel the vibrations with it. So go ahead and say 99.
99. 99.
Okay, and I'm just moving across the chest and then down.
99. 99. 99. 99. 99. 99.
And what I'm comparing here is that I feel the same vibrations on each side. It's not so much really how much vibrations you feel, but more of like a comparison that it's the same. And you'll notice that if you do get your hand over a bone and he says 99, you won't feel that nice vibration. So you want to make sure you're kind of between the ribs. I'm going to do the same thing. I'll have you flip around and we'll look at your back here. Sorry, lots of turning. Okay, so same thing, I'm just going to kind of palpate starting up here. Again, looking for those pain or tenderness, any masses or lesions that I see. Okay, and then we'll do the 99 again. Just say 99 when you feel my hand hit your back.
99. 99. 99. 99. 99, 99, 99, 99, 99, 99. Okay. Excellent.
Again, comparing side to side, making sure the vibrations feel about the same amount in intensity. The next thing I'm going to look for while he is facing back like this is for equal symmetrical lung expansion. So what I'm going to do is put my hands around his lower ribs. So with my hands placed on his kind of like last set of ribs here, I'm going to have my thumbs towards the spine. And then what I'm going to do is push in medially to get some skin there. And what I'm looking for is when I have him take a deep breath in, you'll see it kind of move out. We just want that to be symmetrical. So go ahead and take a big deep breath in for me. And out. Perfect. So you can see both of my thumbs moved out kind of at the same time as his lungs inflated. So that's just another way, instead of just visually looking, to have a little test to see if both lungs are expanding equally. Okay, moving on to the next part of the assessment, which is the percussion. We will do percussion on the anterior and posterior side again. And the way that I'm going to do this is by using my non-dominant hand and placing it on the patient's chest, and then with my dominant hand tapping my middle finger with my other middle finger to get that percussion. With the percussion, I'm wanting to hear a nice resonant sound, just meaning that the lungs are filled with air. If it's like over a rib or over a bone, it'll be a lot duller sounding. So I'll want to percuss in the intercostal muscles between those ribs. I kind of just will start up here and just do like 2 taps like this, just kind of a quick tap tap, and then again I'm just going to move over laterally and then down. And then we'll want to make sure that I'm just going to have you move your arm a little bit here, kind of getting these sides here too. Okay, and then we will do the same thing on the back, so I can have you turn around. Okay, so the same technique, and again, we'll start up pretty high here to get these upper lobes and then just move down the back. You kind of just want to map out where the borders of those lungs are. And then we want to make sure that we're percussing laterally as well to hear those middle lobes. So we'll kind of go over to this side. And then the same thing over here. Okay, the next thing we're going to be doing with the percussing is the diaphragmatic excursion. And what this does is it maps out the diaphragm movement during a full inspiration and expiration. So what I'm going to have So do here is take a deep breath in and hold it. And I'm going to percuss and mark where it changes from that resonant sound to that more dullness sound. So the resonance will be kind of a low pitched hollow, and it should change to a dullness. And then I'm going to just mark on each side where that is. So go ahead and take a big deep breath in and hold it. So I notice it's right about here. So I can just kind of mark it with a pen. I'll just mark it with a nail here. Go ahead and breathe out if you haven't already. And then we'll do the same thing on the other side. So go ahead and take a big deep breath in. Hold it. Okay, about right here again. So we'll mark that. So it's about the same right here on both sides. You can breathe out. Okay, and then we're gonna do the same thing except when he exhales. So go ahead and breathe in and then breathe everything out and hold it. Okay, and then so we're just gonna percuss down and see. So his is about right here, and we'll do the same on the other side. Same thing, let all your air out. It's kind of hard to hear. Okay, about right there. So his gap was about this long. On a healthy individual with healthy lungs, between about 3 and 6 centimeter gap is normal. Okay, and then we will move on to auscultation. So go ahead and turn back around. For the auscultation, we'll listen to the front and back, and I will listen to 8 different spots on each side, and I will start above the scapula and then move down, moving laterally and then down. And so I'm just going to have him take a deep breath every time the stethoscope touches him. And I am using the diaphragm portion of the stethoscope here. Okay, so just every time this touches, just breathe in and out. And I'm comparing one side to the other. Excellent. And then I will have him turn around and listen to the back. Okay, so same thing, just take a deep breath whenever you feel this. You saw the last 2 that I did. I was listening to the lateral aspects, a little bit under the armpit here to make sure that I'm listening to those middle lobes as well. So when I was listening, I heard all clear lung sounds on this patient. Some different things I can be listening for are crackles, which are like really coarse sounds. I could also hear wheezing, which is common in someone with asthma or like bronchiolitis. And it's just like air trying to get through a constricted space. So it kind of just has that wheezing effect. Rhonchi you can also hear, which is a really, really coarse, rough sound. So all those would be concerning. Then again, listening that they're even on both sides. Are they diminished? Do you hear like the lowers less than the uppers, like the air isn't going to the lowers? And then just like comparing both sides to make sure that they're equal and that you're hearing sounds on both sides. So with that concludes the pulmonary assessment. Thank you for watching.